Hi, I'm Shravika, presenting our work on model framing of mental health discourse and its relationship to stigma. This work was done under the guidance of my advisor, Dr. Munmun Choudhury at Georgia Tech. Before beginning, I would like to provide a content warning. Based on the nature of the topic, the presentation contains descriptions of mental illness and suicide, which may be triggering to some consumers. Studies have found that individuals often rely on mass and print media as important sources of information about mental health. On the other hand, with the increased adoption of social media, people often turn to them to raise mental health awareness and seek support. Furthermore, the sociological notion of framing supports that mental health discussions can increasingly shape societal perceptions in the public sphere. As a result, they not only inform the public what to think about, but how to think about mental health. Morality has shaped how we extend mental health care for several decades. As a result, understanding the framings of mental health in public discourse through the lens of underlying moral values can shine a light on the roots of specific framings. Additionally, scholars have emphasized a need to understand how the moral standing of individuals and groups impacts the transmission of stigma associated with the phenomenon. According to Corrigan and Penn, in the context of mental illness, stigmas represent invalidating and poorly justified knowledge structures that lead to discrimination. Additionally, investigating stigma through understanding moral experiences provides a new interpretive lens to gauge the behaviors of both the stigmatized and the stigmatizers. With knowledge of the moral framings of mental health, it may be possible to craft measures that reduce the negative portrayal of mental disorders by creating more effective anti stigma interventions. Given the context provided so far, we looked at three research questions. First, we explored moral framings of mental health discussions on two platforms, that are Twitter and News. Next, we tried to answer how stigmatized the discussions are. And finally, we studied the relationship between moral foundations and stigma for mental health discourse on both Twitter and News. Our work is the first to explore human moral values in the context of mental health discourse. This also contributes towards a cross-media analysis of mental health framings and mental health stigma. Finally, we created a validated dictionary to study stigma. This dictionary is also made publicly available to the research community. As mentioned earlier, we looked at the framings of mental health discussions on Twitter and news media. Our decision to use Twitter stems from evidence that Twitter is widely used as a platform to fight mental health stigma and raise awareness. Having a combination of social and print media platforms enabled us to compare mental health discussions authored by the general public and journalists. In this work, we focused on tweets and news articles authored within the time frame of March 2020 to October 2021. Relevant tweets and news articles were filtered using 30 predefined mental health keywords that were curated by public health experts. We further filtered the relevant tweets to remove self-disclosures. This step was performed to make a more fair comparison between Twitter and news, since news articles are unlikely to discuss one's own mental health challenges. We also removed tweets originating from organizational accounts. We studied the moral framing of mental health discussions using a framework built on moral foundation theory. The moral foundation theory consists of 5 foundations, each containing a virtue and a vice component. These are care harm, fairness cheating, loyalty betrayal, authority subversion, and sanctity degradation. To study the framing of mental health discussions alongside these dimensions, we make use of the Moral Foundation Dictionary, consisting of keywords to represent the virtue-wise components. We used word-based representation learning to get embeddings for the 5 moral foundations. We utilized a pre-trained word language model to generate word embedding representations for all the keywords in a dictionary, along with their relevant synonyms extracted using WordNet. These word embeddings were then averaged to create a final representation of each moral foundation component, that is one each for the virtue and vice facets of the 5 foundations. Finally, following the semantic axis approach used in prior work, we subtracted the representation for the vice component from the virtue component of each moral foundation to obtain a single linguistic representation for the same. We extracted the sentence level BERT embeddings to create representations for tweets and news articles to capture the framing style and context. To quantify model framing of a tweet or news article, we calculated their alignment to each of the 5 model foundations. Alignment of a tweet or a news article to a model foundation was obtained using the cosine similarity metric. Furthermore, with careful inspection, we decided on a threshold of 0, that is, tweets or news articles with a score greater than 0 aligned with the virtue component of the foundation and those with less than 0 with the vice component. Finally, to measure stigma, we followed the virtue-wise characterizations of model foundation theory to create a new approval stigma frame. We curated dictionaries to represent the approval and stigma components, referring to existing research on the conceptualization of stigma. Again, the keywords in the approval stigma dictionaries were expanded by adding relevant synonyms using WordNet. Lastly, to quantify mental health stigma, we followed the same word-based representation framework procedure, which was then used to quantify model framings. Through the raw distribution statistics of cosine similarity scores, we observed that Twitter's mental health framings across all the 5 model foundations align more with the virtue facet in terms of having a larger proportion of tweets that align with the positive dimension, having a cosine similarity score greater than 0. For all the 5 foundations, the histogram distribution for Twitter is shifted towards the right of that for news, indicating that Twitter uses more virtue-oriented model framings compared to news. As summarized in the table, a larger proportion of tweets aligned more with the negative stigma facet than the positive approval facet, indicating the discourse to lean more around stigmatizing frames rather than ones that were more accepting of mental illness. A similar trend was also observed for the news articles. Still, upon comparing Twitter and news, Twitter, like the above 5 model foundations, uses more approval-based framings indicated by a higher approval to stigma article alignment ratio value. We found a positive correlation between the scores for the approval stigma dimension and each of the 5 model foundations. This implies that when a tweet or a news article discusses mental health, if the underlying model foundations are framed more virtuously, then the tone is also indicative of a more approving framing rather than a stigmatizing one. The paraphrased news article excerpt on top attempts to normalize teen mental health challenges and calls for an inclusive ecological approach to tackle the challenge. This excerpt does not only uses virtuous framings, but also advocates for educating and making parents more aware as a means of destigmatizing teen mental illness. We anticipate that Twitter's platform affordances, in particular its broadcasting nature and context collapse, could be responsible for users to employ virtuous internal attitudes. On the other hand, news media sensationalism and political leanings may influence journalistic model underpinnings, resulting in vice-oriented mental health framings. Our findings offer important implications relevant to understanding media trust, particularly among marginalized communities. When mental health issues are framed with viceful model foundations, as our results showed, such discourse may further erode media trust. Finally, we suggest possible approaches to address these implications, such as strengthening journalistic guidelines. We could also carefully incorporate algorithmic nudges and recommendations, which have been suggested as a viable way to build more functional online support communities. To conclude, in this work, we quantified model framings of mental health discourse on Twitter and news media using model foundation theory. Through our findings, we observed that Twitter had a greater tendency to align with the virtue components of all the 5 model foundations compared to news. Textual content with pronounced vicious model frames tended to be stigmatizing. A potential future work of the study could be to explore the influence of specific mental health framings on consumers. Please feel free to contact me via email if you have any questions or feedback. Thank you.